Today I'm going to introduce the concept of the valve clinic to you. How did this valve clinic come about? How did we go about forming this clinic? I went to Budapest in the end of 2016 to learn about this therapy. And when I went there, I realized that the success of this entire program that they were running of TAVI or transcatheter aortic valve implantation was based on team management. So they had a team of cardiologists, cardiac surgeons, they had interventional radiologists, anaesthetists, cath lab technicians, and of course the radiologists for the CT scanning. So it was a total team game. 5 cardiologists, Dr. Ankur Patarpekar, Dr. Kayan Siodia, Dr. Srinivas Kodua, and Dr. Amit. And subsequently we expanded the team to have our own cardiac anesthetist. That's very, very vital. And then came Dr. Chinmay, Dr. Gauresh, and Dr. Praveen. The interventional radiologist, we had support of Dr. Bhavesh Popat all the time. And our CT radiologist was Dr. Zina Patel. And this is how the valve clinic was formed in 2017. Now something about the valve clinic that you need to know is that we were the first ones to start TAVI in the western part of India. The valve clinic deploys all commercially available valves. Each patient has a different anatomy, different height, different characteristics, different location of coronary arteries, and the age of the patient. So based on this, you have to tailor the valve that the patient receives. And we realized this very fast, that if we stick to well valve, then we may be doing slight injustice to some patients where that valve cannot be used. So we wanted to be able to do all the valves properly and then choose the valve which was best for the patient. And this eventually resulted in better patient care, and that was the aim of the valve clinic. We are not only treating national patients, we are also treating international patients. We had a couple of patients from the UAE who were rejected for valve over there, and they were told that nothing can be done. In those patients, we managed to put valves. One was a special valve which was used for the right side of the heart, which is called the trick valve. This was the second valve done in India, and we did that, and that lady is doing very well 3 years down the line. And subsequently, alternate access. What it means that most valves are deployed from the groin or the femoral artery. But there was this lady from UAE, she was 84, and she had no vessels in the groin from which we could have gone and done the TAVI. In that patient, we went from the arm, which is called the axillary artery here, and we did an axillary artery TAVI without any anesthesia or without any cut or without any opening, and we were successful in that. What does a proctor mean? A proctor means that someone like us, for example me, I go to different places all around the country, all around the world, and train doctors on these valves. So that's a proctor. So we are proctors for all these 4 valves. So that's a great achievement for the valve clinic. And the most important feature of the valve clinic, why would a patient choose us? The reason our patient chooses valve clinic is, one, they get proper evaluation, both pre-procedure, intra-procedure, post-procedure, proper follow, and because of such a large team we have, at any given time, the patient can access any one of us 24/7 and get their questions answered. So they are never ever left alone. We completely do hand holding right from the time the patient comes to us. The diagnosis is made, the plan is presented to them, the plan is executed, and post discharge till they are fit completely, we are with them all the way. And in case they need us even after that, the entire team is available at their disposal, and this leads to the best patient outcomes.